The worst Ebola outbreak on record in the Democratic Republic of Congo has been devastating. Nearly 5,000 confirmed cases, over 2,300 deaths. Behind every number is a person, a family and a community, and a health system struggling to cope. Experts say the rare Bundibugyo strain is spreading faster than any previously detected in Congo. There's no vaccine and no specific treatment. For a country that was able to contain its last major Ebola outbreak during the COVID-19 pandemic in mid-2020, there's one obvious question. Why is this outbreak proving so difficult to stop?
Ce qui se passe dans la riposte à l'épidémie Ebola est un non-sens. Beaucoup de moyens, mais sur le terrain, l'épidémie progresse. Et donc, il y a quelque chose qui relève de l'incompétence, de l'irresponsabilité, et même, je dirais, beaucoup plus grave, des criminels.
Welcome to the flip side. The first known Ebola case appeared in eastern Ituri province in late April this year. It was a health worker who subsequently died. When more cases showed up and the outbreak was declared on May 15, there was more cautious optimism than major panic. You see, Congo has more experience fighting Ebola than almost any country in the world. In fact, the virus was first identified in the country in 1976. The Congolese have their own extensive surveillance and emergency response systems. So health authorities moved in quickly when the 17th outbreak on record came along.
Nous avons renforcé les mesures de surveillance sanitaire, la sensibilisation communautaire ainsi que les capacités de prise en charge dans les structures de santé. Les équipes médicales sont formées sur la détection rapide des cas suspects, aussi l'isolement et l'utilisation des équipements de protection.
But despite their swift intervention, Ebola went on to spread into and across multiple provinces.
The situation of Ebola in 3 months now is not good.
The virus is spreading at more than double the rate of the West African Ebola epidemic of 2014 to 2016, when 1,000 deaths were reported over 5 months. Vaccines were still experimental back then. So why is Ebola moving so rapidly now? Let's take a look, because understanding the challenges can sometimes point to the solutions. There's a combination of factors at play in this outbreak. Ebola hit an active armed conflict zone where people are displaced, safe water, food and shelter is limited, and the health system is strained. That's complicating efforts to trace contacts, isolate cases, and deliver life-saving medicines.
Nous savons que particulièrement ici en Ituri, notamment dans le territoire de Djougou et notamment donc ici à Mongwalou, nous faisons face à une crise humanitaire. Et pour nous, cette crise sanitaire qui vient avec la maladie à virus Ebola, il ne faudrait pas qu'elle fasse empirer la crise humanitaire que nous avons déjà pour ensuite nous amener dans une crise socio-économique. Et donc c'est pour ça que nous regardons ça de très près et que le gouvernement s'attelle vraiment à apporter des réponses concrètes pour faire face à cette épidémie.
Frontline health workers say the challenges don't end there. Many don't even have clothing to protect them from the highly contagious disease. Others have raised concerns about salary delays and the strain of working under dangerous conditions.
What makes this extremely critical is that this is mostly personal protective equipment, which helps us in making sure that this infection does not spread, especially with the frontline health workers.
On s'est déjà sacrifié. Et si on continue de rester comme ça, on va se sacrifier dans le vide. Et quand on aura aussi des contaminations, on aura des morts, qui va nous considérer, qui va nous dédommager, qui va nous payer? Premièrement, que le gouvernement puisse songer sur nous. Oui, c'est un grand risque vraiment que le gouvernement puisse songer sur nous.
International partners stepped in to assist Congo. The European Union alone has committed around $35 million since May.
I would say the main challenge is the access, because we are fighting an Ebola outbreak in a region where there is an armed conflict ongoing. So it's very fragile in terms of how the health services can operate, and that makes it much more complicated for the communities, also for tracing the contacts between people and for tracing medical teams and for delivering supplies.
Health experts say the obstacles are significant but not insurmountable. The World Health Organization is supporting surveillance, contact tracing, clinical preparedness, community engagement, and cross-border coordination. Congolese government says stronger community participation is essential to slowing transmission.
Already met the Prime Minister yesterday, and they have already allocated $20 million, and they are mobilizing, and under their leadership, with the support from all partners, we believe that we can.
Congo already has the experience gained from previous Ebola outbreaks. It has trained health workers, surveillance networks, and emergency response structures. So, the real challenge is making those systems work effectively in an environment shaped by insecurity. But then, there's also the question of accountability and public trust.
Et il faut renouveler, changer l'équipe, changer des stratégies pour que ces moyens puissent servir à quelque chose. Et aussi, il faut une transparence financière totale sur l'argent sorti, sur l'ensemble des moyens qui a été décaissés pour que le peuple congolais soit informé.
And that's the flip side.